Hi, this is Dr. Donald Pelto. I'm with Central Massachusetts Podiatry, and I'm very excited today because I've put together this healthcare guide to diabetes in your feet. And I want to give it to you because I offer it to my patients. Because I know if you're like most people, most of my patients nowadays, where do you go when you have diabetes and you want to learn about the problems that can happen? You put the words into Google. And then you get scared because there's a lot of scary websites and information. That's why I'm so excited about this manual, because I put it together for you to help you, to give you information. And in it, I'm going to cover 3 different ways you can prevent a foot wound, the 8 steps about how I do a comprehensive diabetic foot exam, 4 serious foot care mistakes that I see most commonly with my diabetic patients, and then also 4 questions you should always ask your podiatrist or your foot doctor. Now, just for watching this today, I'm going to go over the 4 serious foot care mistakes because I want to give you some information. You're not here because you don't have anything better to do. You're probably going to request my book on the side here, but I want to give you some helpful information. So after doing podiatry and after seeing many patients, there's a few mistakes that I commonly see with my diabetic patients. Maybe you've done one of these, or maybe you want to prevent one of these. Let me tell you some important tips. The first tip, I don't want you ever to trim your own calluses. You may have a callus in the bottom of your foot. You may have a callus between your toes, on the top of your toes. Don't trim them and don't have anyone else trim them. If you're going to see a pedicurist or someone to trim your nails, you shouldn't have them trim it. You have to be very, very careful because it can cause a foot wound. A wound starts, it could get infected, and then it could lead to other problems. The second problem I see a lot of people with diabetes do is they try to trim their own nails when they have ingrown toenails. Now, if your nails are normal, that's fine. But if you have a nail that grows into the edge and it looks a little red and painful, you shouldn't be doing your own bathroom surgery. That's not recommended. You should be seeing someone for that because many times, many patients that have ingrown toenails, that could lead on to losing a little part of your toe. So you have to be very, very careful with that. The third tip is be careful with your shoes. You may say, well, I've always been a size 6. I've been a size 6 since I was 18 and I'm still a size 6. Well, you know what? As you get older, as you have children, your foot size probably doesn't stay the same. You should be measured, and when you get new shoes, if you have any redness, any blisters, any rubbing, you should throw those shoes out or bring them back. Always wear your shoes at home. You shouldn't have to break in your shoes when you have diabetes. There's no such thing as breaking them in, because if you break them in, they're going to break you in and cause a foot wound on your foot. Be very, very careful. Now, if you don't know this, there's a little tip. Most insurances, including Medicare, they cover a free pair of shoes. Now, you may wonder, the government doesn't give me anything for free. Why are they giving me a free pair of shoes? Well, it's because they found if they give out 300 pairs of shoes and prevent 1 wound or 1 amputation, they've made their money back. So that's a question you should ask your podiatrist. How do I get a pair of diabetic shoes? And the last tip, I want you to be very careful, okay? This is very serious. You may not have any pain if you have a foot problem. You may have neuropathy or poor feeling in your feet. You may have a foot problem and not know it. That's why if I can give you one tip as we finish here, that's going to help you prevent a wound, prevent an amputation, prevent any other type of foot problem, it's this. Look at your feet every day. I know it sounds very simple. It's easy, but so many people don't do it. People get busy, they can't flex down there, they can't look at them. If you can't look in the bottom, get a mirror. Ask a loved one to take a look at the bottom of your feet, because by looking at your feet, looking at any changes in your feet, is the most important thing that you can do to prevent a foot wound. So I hope you put your name and your email on the side, and I really hope you'll enjoy this healthcare guide to diabetes in your feet.